There are two main divisions of pharmacology. They are pharmacokinetics and pharmacodynamics. In pharmacokinetics, we talk about what our body does to a drug. There are four main pharmacokinetic processes. They are absorption, distribution, metabolism, and elimination. You can remember these four by ADME. In this video, we'll talk about the first pharmacokinetic process. Absorption is the transfer of a drug from its site of administration to the bloodstream. The routes which we can administer a drug are enteral, parenteral, and also there are other routes as well. Enteral route is administration of a drug via our gastrointestinal system. We can administer drugs orally. We take tablets, capsules and syrup by our mouth. Also, we can take drugs sublingually. GTN, glyceryl trinitrite, which is used to treat angina, is kept under the tongue. Also, we can administer drugs through the rectum. Rectally administered drugs come as suppositories. Look at parenteral route. In parenteral route, there is no involvement of GI tract. The common routes of parenteral administration are subcutaneous, where the drug is directly absorbed by the subcutaneous capillary plexuses, intramuscular route, where the drug is absorbed into the capillaries around the muscle, and the intravenous route, where you administer the drug directly into the systemic blood via a superficial vein. As other routes of drug administration, we can consider nasal administration. We can use nasal sprays, nasal solutions. Here, the drugs are absorbed via superficial capillaries in the nasal cavity. Also, we can administer drugs through the respiratory tract. Volatile liquids, volatile gases, and anesthetic drugs can be given through respiratory tract. They are absorbed into the circulation via pulmonary capillary bed. Transdermal route is another way of drug administration. The drug is administered as a skin patch and across the skin it is delivered into the circulation. Now let's see the pathway which is taken by a drug if it is given orally. From the oral cavity, it is passed through the esophagus, stomach and then reaches to the small intestine where it is absorbed. Then the drug is passed to the submucosal capillaries and then to the mesenteric veins and then to the portal vein. Then the drug goes to the IVC, then to the right side of the heart, then via pulmonary artery to the lungs. Then through the pulmonary veins comes to the left side of the heart. Finally, it reaches to the systemic circulation. So we know that if a drug is given orally, the absorption occurs in the small intestine. That means the particular drug is entered into enterocytes. For that purpose, the drug has to pass across cell membranes. A drug can be passed across a cell membrane by passive diffusion, filtration, and carrier-mediated transport system. Now let's look at the factors which affect the drug absorption. Firstly, the dosage form of a drug is important. We all know that the drugs which are in a liquid form are better absorbed than those in a solid form. So syrups are better absorbed than tablets. Formulation of a drug also has an impact on drug absorption. If the particle size is small, it is absorbed well. The rate of disintegration of a drug plays a role as well. If the disintegration rate is high, absorption is also high. If the disintegration rate is low, absorption is also low. When it comes to the rate of dissolution, if the dissolution rate is high, the drug absorption is also high. If it is low, absorption is also low. Furthermore, presence of diluting substances enhances drug absorption. When we talk about absorption, lipid solubility of the drug also comes into play. If a drug is lipid soluble, it can easily cross the cell membranes which are made up from a lipid bilayer. On the other hand, water-soluble drugs poorly cross cell membranes. The degree of ionization of the drug is also important. If a drug is in its ionized form, it is difficult to cross the cell membranes. Therefore, ionized form expresses a reduced absorption. Conversely, if a drug is present in its unionized form, as it can easily pass through the cell membranes, it has a high absorption. Gastric emptying also affects drug absorption. If gastric emptying is low, there will be a low absorption. If the gastric emptying is high, absorption will also be high. When it comes to bowel motility, if the bowel motility is reduced, there will be more time for absorption. Therefore, reduced bowel motility will increase absorption. But if the bowel motility is high, there won't be enough time for the absorption. Thus, it will lead to reduced absorption. Foods and drug interactions also have impacts on drug absorption. As an example, oral penicillins act best when given on empty stomach because the presence of food will delay the drug absorption. However, foods do not interfere with some drugs. Amoxicillin absorption has no interference with food. Drug absorption is also affected by the inactivation done by the gut. As an example, benzyl penicillin is destroyed by HCl secreted from the stomach. Therefore, if we give oral preparations of benzyl penicillin, the bioavailability will be very, very low. That's why we give benzyl penicillin as IV or intramuscular preparations. But in contrast, phenoxymethyl penicillin is stable in acids. Therefore, it can be given orally. So, finally, a drug reaches to the systemic circulation from its site of administration. The proportion of the drug which reaches the systemic circulation is called bioavailability. Let's talk more about bioavailability from another video. Make sure to hit the bell icon and subscribe. Let's meet from another video like this. Thank you.